Everybody ready for the last session of the day? What's my agenda? This is genuinely terrible timing, I'm afraid, everybody, because you have me again. I'll try and be as quick as I can. So I'm going to start off the final session of the day talking about the preliminary results from the global patient survey that we launched, it seems like ages ago now. Cheryl's then going to talk to us a bit about an update on Landmark 2.0. And lastly, we'll have a talk from Peter about transitioning your organization. Okay, let's dive straight in with the first short talk. Okay, good, it is working again. Here we go. So, since we started MPNAN 7 years ago, something like that, what we began to realize is the massive difference in the patient experience depending on where you live in the world. So an MPN patient in a developed country with a highly evolved reimbursement system or a health insurance system, you are going to have a very, very different experience of living with an MPN to somebody born in a less developed country with less access to expertise, to therapies, etc. So we thought we need to be able to measure that. We need to be able to prove that that is the case. So what we did was 2 years ago, we committed to doing a systematic, there's that word again, global survey of MPN patient needs. So this is the first time anything like that had been undertaken. The basic objective, obviously, was to document and document in numerical terms, quantify the differences in the experience depending on where you lived and depending on other factors, which we'll talk about in a second. The objective of this, the objective is to prove our point, which is that patients have a very different expectation of living with an MPN depending on where they live. But the way to do that, the method that we've chosen, and our short-term objective is to get the results of this survey published in a peer-reviewed journal. And we're just beginning to think about that part of the process, and I'm going to take you through some of the preliminary data that we've got from the study. But more than that, the intention is that as well as creating a one-off kind of snapshot of this picture and being able to make an argument, is that the data that we create, the data set that we create through this process, will itself become a reusable asset, will become something that researchers in other contexts will be able to use this data to inform their own work and to hopefully reinforce some of the data they gather. But it's very early days, and we will see how that part of the objective pans out. Okay, so how do we go about it? From day one, we conceived the whole project as a phased approach. We trialed it in one English-speaking region in Canada. And then the first rollout phase was to be solicited in, we thought, about 5 to 10 English-speaking countries. English-speaking because we didn't want to immediately encounter the translation challenge of the questionnaire. And we would start getting data in more quickly that way. So what we did was we sat down with our medical advisory board in order to devise a set of patient-centric, so in other words, questions written in the sort of language a patient would understand, patient-centric questionnaire about what their needs were, about what they wanted from their doctors, from their therapies, etc. And we, as I say, we trialed it in Canada, and we built in some feedback from roughly around 300 patients in Canada, was it, who trialed it? Around 300 patients saw it before anybody else did. They gave us some very useful feedback. We modified some of the questions a little bit. And then we actually then went for a translation exercise. We translated it, I was just talking to Cheryl just now, we think it was 5 different languages to start off with. And then we rolled it out and we promoted the survey in 8 specific countries. Although what we have found, and you'll see this in a second, is that clearly the link to the survey has been shared much more widely than just those 8 countries, which you'll see in a second. And this is the exciting part, is that literally last month we got back from the data analysis company the initial responses, and the slides that you're going to see are based on what we've seen in that initial report. So, what was the scope of the survey? What were the questionnaire? What were the actual questions we asked? We started out by asking basic data about where do you live, how old are you, what gender are you, what condition do you have, etc. We also talked about how easy is it for you to, or rather, how much information, accurate information, do you have about MPNs? Second thing, how much access do you have to medical expertise? Can you get to see an MPN specialist on a regular basis? That kind of question. So these are just categories. There were 48 questions altogether. How much access do you have to support? Not to doctors, but to, for instance, other patients or patient support groups. Are you aware of, are you participating in any form of research or a clinical trial? And then lastly, a bunch of questions about the impact of the illness on your financial state and your ability to work, etc. So quite a lot of questions divided into those 6 categories. Now, here's the first look at some of the data itself. So the first thing I want to say is that we had a much larger overall number of responses than we were initially expecting from the first rollout, 1,734. And here's the really amazing thing, from 52 different countries, even though we'd actually only actively promoted it in 8 countries. But people clearly shared the link to the SurveyMonkey page, and we've actually got data from 52 countries. But here's the thing, look at the graph. The data that we've got is completely dominated by data from the US, from the UK, and from the Netherlands. We've obviously got a good cohort from Canada, because that's where it was trialed, but then the amount of responses really tails off looking at the other countries. There's 10% come into the category of other at the end, which is sort of anywhere outside those ones that you can see there. Can you read what the countries down at the bottom? Good. So very basic information about the responses that we got. 66% of the responses were from women. 42% of the respondents were over 65, and another 29% were in the range of 55 to 64. So it's very dominated by an older demographic, and some extent biased towards female demographic. We don't yet properly understand exactly why that is. Obviously there are some reasonably obvious reasons, but well, we'll talk about how we're going to sort of develop the data and dig into it further in a second. So here are some headlines, and this is simply based on me sitting by my desk, going through the 124-page report, picking out stuff that just jumped out at me, right? And we'll talk a bit about how we can give access to the report to you guys, and I'm sure you will find interesting things to pick up on and think about yourself when you get to read the full report. So, 7% of patients, only 7% of patients were diagnosed by an MPN specialist, and only 11% were subsequently referred to an MPN specialist. So, the number of people who actually see an MPN specialist doctor is pretty small. Having said that, 90% of patients were confident in their physician's ability regarding their MPN, whether they were a MPN specialist doctor or not, seemingly. Most patients did not have the information they wanted about non-medical aspects of their condition. So if you like, the softer aspects of living with an MPN, things like what's the status of what's my status now regarding my rights or otherwise concerning sick pay with employment, my ability to claim benefits, for instance, that kind of thing. It seems very clear that most patients don't really know what they think they would like to know about that aspect of their conditions. Well over half reported a negative financial impact of their MPN, probably not unexpected, but 18% said it was leading to, and this is the phrase we used in the questionnaire, significant financial difficulties. 18% of those 734 people, that is 1,734 people, that's a lot of people. And this is early days for the rollout of this, and this is in highly developed countries as well. 80% said it was affecting family members' ability to work. So now we're beginning to see the knock-on effect of living with an MPN on your ecosystem, on your family, on your caregivers. This is a slightly, very worrying statistic. The second to last bullet point here: 61% of the respondents said they didn't know other MPN patients. That's a fair point, and it did occur to me when I was writing this, but that's how they answered that question. Okay, so maybe they know an organization, or they've heard of an organization, but are they in touch with people who are living the same life that they are living, and are they getting the emotional support that we know, don't we, Maz, that is so important to living with conditions like these, being able to talk to people who are in, to some extent, the same boat. And I think that really, for me anyway, energizes the certain aspects of the patient support and advocacy mission. Trying to directly reach out to that 61% of people who would probably really, really benefit from just having a conversation with somebody like them. I'm making gross assumptions here. We're only looking at data. We're not actually having real conversations with real people. But nevertheless, I think these numbers are quite instructive. And lastly, over half the people that responded didn't know as much as they wanted to about clinical trials and the trial process. Again, maybe not that unexpected, given the very broad kind of coverage of the survey. So, as I say, these are just some of the things that jumped out at me when I was flicking through the report about a week ago. Okay, and delving into it further, I'm sure we will see other interesting and eye-catching aspects of what we found out. So, as I say, the interesting thing about the data set is that we're able to correlate all of the factors against any other factor. So, for instance, in theory, we could say, how many older Dutch men were diagnosed by a specialist? I don't know why you would want to ask that question, but you could, and you'd get an answer from it. But I'm sure that over time we will be able to ask much more interesting and relevant questions. But the great thing is now we have that data set, and we will be able to reveal things about the MPN patient community that we were not able to reveal before, at least not in a data-centric way, as opposed to the more anecdotal evidence that I'm sure we all carry around in our heads day to day. So now we talk about the actual data set itself, so it's a slightly technical term. Now, when we have more extensive geographical coverage, so that's quite a loaded phrase there, but we'll talk about that in a second. We believe that the data we've gathered by the survey will be an asset that will go on having value for a long time to come, because it's this ongoing picture of what the MPN community, what it's made up of, but also what their condition is as it was when they were surveyed. We believe that advocates will be able to use the data to make the case for improving patients' lives in their countries. We will believe that MPN researchers will be able to use the same demographic data to inform clinical research. Now, the last point here is highly debatable and highly constrained by regulation, and by ethical concerns, frankly. But what we would like to be able to do is to make the data available, and I'm not talking about a financial transaction here, but being able to make it available on a controlled basis to validated researchers or validated communities. And it's very, very early days in terms of how we do that process, how we do make that available. But I'm not here to tell you that we have the answers to all of that right now, but we know it's one of the things that we need to consider quite carefully. Next steps for this, clearly, surveying the US, the UK, and the Netherlands is nowhere near enough. Okay, so we need to roll out our survey in as many countries as possible. We know that one of the major barriers to that is translation. So we will increasingly make the questionnaire available in other languages. And what I'm hoping here is that people in the room here are thinking, I need to roll this out in my community. I need to get it translated into this, and this language. Please talk to us, and we can talk about how to make that happen. And lastly, as I said at the beginning, the intention is that we prepare a properly written, properly presented, properly justified paper that we will then present to the most appropriate journal, professional journal, in order that we can start revealing some of this data more broadly in the medical community, but also in the advocacy community. 2 points that I want to make here. So far, the work that's gone into this has primarily been done by Cheryl here. As I said, we relied heavily on the medical advisory board to validate the actual nature of the questionnaire. So we haven't really been able to draw on any huge amount of kind of input to this process. And as we develop it and as we move it forward, we will need more manpower to make that happen. And if you'd be interested in helping work on that process, I think that would be a great way to get involved more in the international community. And what it has revealed, being blunt with all of you, is it's really revealed the relative lack of capacity that we have in MPNAN for taking on projects like this simply within our own volunteer base. And that's partly a statement of intent about where we're going to be going as a steering committee and as a group going forward, but also as a asking you guys to please let us know if and when you're willing and able to get involved in these types of projects. So a little kind of pitch from us at the end there. I think that's pretty much all I wanted to say about the survey at this point. The takeaway for you guys is, firstly, some of those points that I pointed out, but also to say that we're just scratching the surface with the data here. We need a much broader data set from other countries, clearly. We also need to ask more interesting questions. We need to look at that data in a more thorough and more far-reaching way. But we definitely wanted to share with you the initial thoughts that we had about it, and then some of the data that we've got from it. Okay, that's it for the survey. Thanks.